Hello. I wanted to give you additional information about Medicare because after I finished the last video, I realized there's so much more that you need to know. And I want to talk a little bit about the costs related to original Medicare because they could be quite high, and I want you to understand them. The figures that I'm going to give you today, the amounts, all refer to 2020. They will probably and most likely will increase for 2021. And normally Medicare lets us know of those increases by November. And I promise to get that information in a short video as soon as I receive that so that you can be informed with how much it will cost in 2021. So let's start with, and I'm wearing my glasses because I want to make sure I get all the information to you today and not leave anything out. But let me talk a little bit about Medicare. A lot of people think that you have to have worked in this country for X number of years in order to be eligible for Medicare, and that is not the case. Medicare is a federal insurance for individuals 65 years and older. In order to be eligible for Medicare, you have to meet 3 conditions. Be at least 65, have lived in the United States for 5 consecutive years, and be at least a permanent resident. If you meet those 3 requirements, you can buy Medicare. And a lot of people choose to do so because it's actually, even though I'm going to talk about the cost, it's high, it's a lot cheaper than it is if you were to buy a private policy. Living in South Florida, we get people who come to the country all the time, investors, just come here to retire from other countries and have the money to buy this insurance, and they can. As soon as you meet the 3 requirements, you can file for Medicare. I tell individuals to file for Medicare 3 months before age 65 because that's their initial enrollment period, and that is true. However, if you don't have the other 2 requirements, that is not your initial enrollment period. Your initial enrollment period is when you meet the 3 requirements: age 65, living 5 consecutive years in the United States, and being a permanent resident. Now let's talk a little bit about the different parts of Medicare and the costs associated with those parts. Part A is your hospitalization. And normally Part A is free. If you've worked at least 10 years and contributed into Social Security, you don't have to pay a Medicare premium. It's really not free. It's just that while you were working, you were paying Medicare premium, Medicare tax, which therefore now give you the ability to have the Medicare Part A for free. You don't have to pay a monthly premium if you have 40 credits. Now, if you did do some work in this country but didn't reach the 40 credits, but you have between 30 and 39, you pay a lesser premium. And if you have 40, of course, it's free. So your premium for 2020 for Part A is $458 a month if you have less than 30 credits of work in the country. If you have between 30 credits and 39, then you pay only $252. And if you have your 40 credits, you pay 0. So the premium for Medicare is 0 if you've worked at least 40 credits, but if not, according to the credits you have, you can pay $252, which is a lot less than the $458 if you don't have 30 credits. So know that you can purchase Medicare, and if you compare it with other plans in private policy at the age of 65 or more, it's not a bad deal. So that is Part A. Now, what deductibles and what coinsurance do you have with your Part A? The deductible is per hospitalization, and in 2020, that deductible is $1,408. That means if you are hospitalized today, you will have to pay the hospital your $1,408. If you stay less than 60 days in the hospital, that's it. Medicare will cover 100% after you pay your deductible of that hospital stay. If you stay over 61 days or longer, you will have to pay a higher premium, and it depends. Between 61 days and 90 days, you will pay a coinsurance of $352 a day. Over 91 days is $704 per day. So those are the deductibles associated with Part A and your premium. Now Part B. Part B standard premium is $144.60 a month for 2020. You can pay more if your income is higher. I will do a video just for the higher income once the 2021s come out. I don't want it included here because it'll make this super long, and it doesn't affect most individuals because most individuals don't have incomes over that limit. So your basic premium for Medicare Part B this year is $144.60. Now, what does Medicare Part B, and this is original Medicare, not with Medicare Advantage plan, what does that deductible and copayment? Your deductible for Part B, which covers your doctors outside of the hospital and inside the hospitals, as well as your tests done in a hospital, but not as an inpatient, like if you go get a scan or any medical exams, are covered under Part B. Your deductible is $198 for 2020. And then you have co-payments or co-insurance, and that is 20% of the Medicare approved amount. And that includes, like I said, most doctor services while in the hospital. So any doctor that comes in to see you in your room when you're hospitalized says, "Hey, Maria, how are you doing?" And that's a specialist. You know how high their charges are. You are responsible for 20%. So the advantages to the Medicare Advantage plans are that most of them are going to pick up your deductible, that $1,408, and also that 20%, including the $198 deductible for Part B. So keep that in mind with the cost related to the Medicare Original Plan versus the Medicare Advantage. And this gives you ideas or questions to ask those Medicare Advantage plans. Do you cover all the deductibles? Do you cover all the coinsurances, etc.? Part C are the Medicare Advantage plans, and most, like I said in my prior video, do not have payment, but it depends on which plan you elect, and you can see the different plans that will be available in 2021 very soon and do a comparison for yourself. Part D, I'll just touch briefly on this. Part B is your prescription drug plans. The costs vary from plans to plan. The average plan right now is between $32 and $37, somewhere in between there. That's the average monthly premium. They all have deductibles. They all have that donut hole. So there's a lot of co-payments and co-insurance that are not covered in the Part D, depending on the medications you take. I suggest that you do a good study depending on your needs. Some people need more, take more medications. Other people take less medications and maybe need other additional coverage. So now that you have this information, you can determine what you need and then look at the plans to make your choice. But just know that you can keep your original Medicare, but if you choose the original Medicare without buying a supplement policy or Medigap policy like they're called, you will have a lot of out-of-pocket expenses if you do end up in a hospital and even with just seeing your doctors. I hope this information has been helpful to you. I try to give you the most important points that I found through my years working with Social Security to help individuals and working aside with the SHINE program, which I recommend you look into, which is a great program that can help you with making a choice. They will not sell you anything. They are hired by Medicare, paid by Medicare to educate individuals on Medicare services. So I do encourage you to contact them, and I'll give the local SHINE number here and also in the website in my remarks below. Subscribe to my channel. I'll be giving a lot of information, especially now with so many things changing for 2021. Thank you.